A silent threat. 8 signs that could indicate blocked arteries. Think of your body as having a complex network of tiny tubes carrying oxygen and important things to every part. These tubes are your arteries, vital for your health. But like any important system, they can get hurt, causing lots of health problems. Arteries act like highways in our bodies, moving oxygen-filled blood from the heart to everywhere else. This keeps our organs working, feeds our tissues, and gets rid of waste. If our arteries aren't healthy, this system gets messed up, causing tiredness, pain, harm to organs, and even dangerous things like heart attacks or strokes. Many things can mess up our arteries, like bad diets, not moving enough, and health issues like diabetes or high blood pressure. Sadly, these problems often happen quietly, getting worse without any signs until it's too late. That's why looking after our arteries is super important. In today's video, we'll talk about 8 signs that might mean blocked arteries and why it's a big deal. By recognizing these signs and seeking timely medical attention, you can take proactive steps to protect your arteries and prevent further damage. So stick around till the end. 1. Chest pain or pressure. Heart discomfort, often felt as a tightness or pressure in the chest, stands out as the main sign of clogged arteries. This discomfort usually sits in the middle or left part of the chest and might spread to the jaw, neck, arm, or back. According to the American Heart Association, around 70% of people facing a heart attack experience chest discomfort. The kind of chest discomfort linked to blocked arteries can vary. Some describe it as a lingering ache, a sudden sharp feeling, or a burning sensation. A few liken it to something heavy pressing on their chest, while others say it's like an enormous weight sitting on them. The intensity of this discomfort can change, from being mild and coming and going, to being severe and lasting. Remember, while chest discomfort is a key sign, it's essential to note that it could be a symptom of other conditions too. So, feeling chest discomfort doesn't always mean an immediate cause for alarm. 2. Shortness of breath. Breathing difficulty, also called shortness of breath or dyspnea, is a common sign of clogged arteries and other heart issues. It can happen when you're resting or doing activities, and might get worse when you lie down. This happens because the heart, not getting enough blood due to blockages, struggles to pump sufficient oxygen to the body's tissues. The seriousness of breathing trouble can vary. In mild cases, people might feel a bit out of breath, while in severe cases, it could be really hard to breathe, feeling like you can't get enough air or are suffocating. Sometimes, this breathing difficulty can happen suddenly, or it might gradually get worse over time. No matter how mild or intense it feels or how quickly it comes on, never ignore breathing trouble. If you experience this, especially if it suddenly gets worse with activity or lying down, or if you also feel chest pain, dizziness, or fatigue, it's crucial to get immediate medical help. 3. Fatigue. Feeling constantly tired and lacking energy, known as fatigue, can be a major sign of coronary artery disease, even if other typical signs aren't noticeable. A study in the Journal of the American College of Cardiology highlighted a strong link between fatigue and coronary artery disease, emphasizing how important it is to notice this often ignored symptom. This kind of tiredness isn't like feeling tired after a long day or hard work. It's a deeper and lasting exhaustion that doesn't get better with rest and makes daily tasks harder. People with coronary artery disease-related fatigue often say they feel drained, find it hard to get going, and struggle to concentrate. The exact reason why coronary artery disease causes fatigue isn't entirely clear, but a few things contribute to it. When the heart doesn't get enough blood, it can't deliver enough oxygen, affecting the body's energy production. Also, the stress and worry that come with coronary artery disease can add to feeling tired all the time. 4. Dizziness or lightheadedness. Feeling dizzy or lightheaded, often like you're unsteady or about to faint, can signal an issue with blocked arteries, especially those supplying blood to the brain. This happens because the brain needs a steady flow of oxygenated blood to work well. When there's a blockage limiting blood flow, the brain doesn't get enough oxygen, causing dizziness or lightheadedness. The intensity of dizziness can vary. Some might feel a bit off balance or unsteady, while others might feel like they're going to faint or even pass out. Also, these dizzy feelings might come and go quickly or last for longer periods. 5. Nausea or vomiting. Feeling sick to your stomach or throwing up isn't as common with blocked arteries, but it can happen, especially during a heart attack. This occurs mainly because of two reasons: the body's stress reaction and less blood going to the stomach. During a heart attack, the body releases hormones like epinephrine and norepinephrine due to stress, which can lead to feeling queasy or vomiting. Also, when arteries supplying blood to the stomach get blocked, the stomach doesn't get enough oxygen and nutrients, causing nausea and vomiting. The seriousness of feeling sick and vomiting can vary. Some might feel a bit nauseous for a short while others might keep throwing up along with other signs like chest pain, trouble breathing, and sweating. Remember, feeling sick and vomiting can be signs of different issues apart from blocked arteries. So, if you have these symptoms, especially with other worrying signs, it's essential to see a doctor right away for the right diagnosis and treatment. 6. Pain in arms, legs, or feet. Feeling pain in your arms, legs, or feet can signal a problem with blocked arteries, especially in a condition called peripheral artery disease, PAD. This happens when the arteries that carry blood to your limbs become narrow or blocked, reducing blood flow and causing pain. The level of pain and where it's felt can change based on how severe PAD is and which specific arteries are affected. Some might feel mild pain that comes and goes, while others might have constant strong pain that really affects their daily life. 7. Numbness or tingling in hands or feet. Feeling numbness or tingling, often like pins and needles, might signal a problem with blocked arteries, especially in a condition called peripheral artery disease. This happens when the arteries supplying blood to your limbs become narrow or blocked, reducing blood flow and affecting the nerves. How much numbness or tingling you feel and where it's felt can change based on how severe PAD is and which specific nerves are affected. Some might feel a bit of tingling in their fingertips or toes, while others might feel complete numbness in their hands and feet. Remember, numbness and tingling in your hands and feet can happen because of different things, like carpal tunnel syndrome or not enough vitamins. So, it's important to see a doctor to find out the exact cause. 8. Erectile dysfunction. Having trouble with erections, known as erectile dysfunction, can sometimes be an early sign that something's up with your arteries, even if you don't notice other issues. This connection comes from the fact that the same blood vessels that feed your heart also supply blood to the penis, helping it get hard. When these blood vessels get blocked, both the heart and the penis might not get enough blood. This lack of blood flow can cause erectile dysfunction, making it hard to get or keep an erection. Sometimes, erectile dysfunction might show up before other signs of blocked arteries, so it's an important warning sign to pay attention to. Getting treated early for erectile dysfunction is important for a few reasons. First, it can really affect a man's life and how he feels emotionally. Second, seeing erectile dysfunction as a possible sign of blocked arteries can lead to more checks and finding heart issues early. This can help prevent bigger problems like heart attacks or strokes. Remember, our arteries play a crucial role in keeping us healthy and vibrant. Taking steps to care for them, such as eating a balanced diet, staying active, and managing health conditions, can significantly improve our overall well-being. If you're facing any of these 8 signs, it's important to talk to a doctor. They can find out what's causing it and help you get the right care. Taking care of blocked arteries early can make you happier and, most important, keep you healthier. And now I encourage you to share your experiences and thoughts in the comments below. Have you ever experienced these signs before? If so, how have they affected your arteries? I hope you enjoyed this video. Please like, subscribe, and hit the notification bell for more health-related videos. Thank you for watching.